Good morning, ladies and gentlemen. Welcome to the platform for education. We are on Liberian Radio and Television Network. This morning, we will be talking on the coronavirus for right now, because this is what we are confronted with right now. So we'll continue to educate you on the coronavirus, how it is transmitted, and what are we doing to stop the spread or the transmission of the virus, according to the World Health Organization or the CDC recommendation. So we will be talking about this. You can see coronavirus when you're trying to search the type of virus. You see what is it. You can see at the back, at my background, you see what is we're looking at right now. So we know that the coronavirus has, destroyed a lot of people, and especially those who have pre-existing condition. Pre-existing condition, when we say pre-existing condition, we're talking about people who had chronic obstructive pulmonary disease called COPD. You got lungs problem, you got heart problem, you got diabetes and other things like that. Any disease that will bring down, that will reduce, all right? This is not good for people like that. Besides, we're talking about people in their 60s who are not very strong. You can be in your 60s, but if you used to doing exercise, your body will be in good shape, and then you can stand the coronavirus. Mind you, the coronavirus is just like somebody has a common cold. All right, there are about 200 of these viruses are there. If we could have, if the virus that cause common cold, if we could have developed antibody against the virus that cause common cold, nobody is going to be worrying about having common cold. You see, but because the virus that cause common cold are so many, that's why we do not have antibody developed towards common cold. So anytime you have a common cold, it may be due to another virus. And after you recover from that common cold, you develop antibody against that particular virus. Next time it come around, you will not be sick. So next time another virus will come and you will catch it again, and you will be sick. After you recover, you develop another antibody against that. So like I said to you, there are more than 200 viruses out there that can cause common cold, and we know coronavirus is one of those viruses that we're talking about. All right, if you have a very good body, a younger person who is not smoking, who is exercising, who is eating right, and your body is strong, you are in your 40, 50, around that time, around that age group, and you are exercising nice. It is not, like 80% that when you get the coronavirus, it's going to overcome you. No, you will overcome that coronavirus at least 85% of the time with that kind of good body structure, good body mechanism, because you don't smoke, you don't drink, you exercise, you eat right, your body is in good shape, your immune system is in good shape. All right. So now, how do we get this coronavirus? You can see me now. I got a mask right on my chin. You can see that is one of the recommendations of the CDC or the World Health Organization, that we should use this as a means to stop the spread of transmission of the coronavirus. So we got to be wearing masks. So everybody now, you see everybody wearing masks. It's like we are all considered to be infected. You know, before you get into the shop to shopping, they will say wear mask because we know that we don't know you. You may be infected. So nobody know who is who. That's why we are wearing masks. You see, the coronavirus is spread through a droplet. You see, when it is spread through a droplet, this is why we are wearing masks. You can't get the coronavirus because you touch somebody. No, you will get it because you cough around somebody, and you cough in front of somebody. You must be standing in that person's personal space. When we say the personal space, it means that you are closer to that person. You are less than 1 yard or 1 yard to 2 feet, closer to that person. And you will be speaking to that person for over 10 minutes. For over 10 minutes, you could spread the virus right to that person. You see? That's the person's personal space. So they consider everybody to be infected. That's why they say use a mask. So if you use a mask now, you're talking, you're sneezing, everything is contained. The droplet is contained in the mask. All right? When the droplet is contained in that mask, the possibility that you transmit the virus to somebody is like 5%. But 80% or 85% of the time, 95% of the time, you will not transmit the virus to the person when you got a mask on. All right? That's number one concerning this. So we already declare, it's already declared that the virus is transmitted through a droplet and through the respiratory tract. Okay? That's one thing. It is already declared that. The next thing is, if we know that the virus is transmitted through a droplet, all right? When you are sneezing, you sneeze in a napkin. When you are coughing, you cough in a napkin. Sometimes they will say, if you don't have those things, you cough in the air bowl, something like that. You see? Then, that means if you want to speak to somebody for over 10 minutes, then you should be standing a distance from that person. That should be 6 feet from that person. All right? 6 feet from that person, you can talk to the person. All right? In that way, it's much better. You see? Suppose you don't have the mask. If you don't have the mask, then stand 6 feet from that person, and the person, you will talk to that person because you don't know whether the person is infected or you are infected. Okay, you stand 6 feet from that person. All right? So, in addition to the mask wearing, you can wear your mask, then you stand 6 feet from that person. Don't invade the person's private, personal space. Do not do that. All right? This is how we are going to prevent the spread of the virus from person to person. Okay? But you see, what I'm doing to you now is education. But the other side, let's say on the African continent, all right? We know the African continent is in the tropic, is very hot. Virus does not, most of the time, live for a long time in a hot tropical area like that. So the virus does not survive for that long. Then, like it will survive in America. America is a cold area. We are in the Western Hemisphere. It's a very cold area, but the tropical area is very hot. All right. Even though it is hot, but what we think we should do over there is to do what? Is to still come up with what we call education. Let's educate our people. First thing, we got to establish this is a contagious disease. This is how it is transmitted. All right. So for right now, we're going to take a little break and come back, explain how we would do it on the African continent. Okay, good morning again to you, people in the radio land. We are just, we took a little break, and while you were looking at over there, we were running a little ad that has to do with the census. You know, every year in a democratic country like our own, the government had to run a census. They had to count a lot of people. They had to count every one of us that living here. As long you are on the continent of North America, you got to be counted. All right? They have to count you so that the government know how in 4 years' time, how many children was born, how many people had died between that time, so that if, for instance, certain area, many people were not there, but it happens that in 4 years' time, a lot of people move into the area. A lot of people have given birth to children and then they have grown up in that area. Now, what that area would need a school. That area would need a clinic. That area would need government hospital. That area would need a commercial area and all that kind of thing. So, government will be able to provide these benefit. All right, government will provide benefit, will provide services to those people in that area. This is one reason why the government want us to, for everybody to be counted. If you are counted, government know that you are there. You are counted, the government can never forget you. And then any services will be, you have the right as a citizen or as a resident living in America to receive medical care. That medical care will be provided to you over there. That's why, those are some of the reasons why that we have to be counted. Everybody had to be counted. All right. So that was the eye you were looking at. All right. Back to the topic on education on coronavirus. We were talking about the coronavirus. In our area, our African country, I feel that it will be much better if you are educating the people, or you are telling the people how to prevent the spread of the virus, what you should do. First of all, we get a team. We already have a team that will go around, and that team is headed by the doctor and an administrator and a field worker. They will go around and educate the people on how the disease is spread. When they educate the people on how the disease is spread, and they will come up with how the disease is spread. So in case you get the disease, what are the signs and symptoms that you are going to be experiencing? And when you get the signs and symptoms, what is the next step do we take? All right? We say that the virus first, we recognize the virus as a coronavirus. All right? Then the next thing we do is we educate you as how this virus can be transmitted from person to person. We declare that this virus can be transmitted from person to person through the respiratory droplets. You sneeze, you talk to somebody, you cough, and the person is closer to you, and you're talking to that person for over 10 minutes, that person can get the virus. It's just like somebody who got common cold, and you're sitting down in the classroom and the person sneezes. Majority of the children sitting over there will have common cold in a few days to come. You see? So, because the causative agent of this disease is a virus, and the length of time it takes for the virus to affect anybody is 7 to 14 days. That's the reason why the people say if you are in close contact with somebody who has a virus, and after a day you got to know that this person has a virus. Then what you have to do is to keep yourself in a closed area for 7 to 14 days, because that's the time the virus takes to replicate itself to cause you to be sick. So you will be somewhere for 7 to 14 days. So after 7 to 14 days and nothing happened to you, then your immune system is good, then you're all right. Okay, that is the quarantine side of the virus. Now, we say already that the virus is transmitted from person to person through droplet, respiratory droplet. That is when you cough, and that's the only place that the virus can enter in order to affect you. We already know that. Then the next thing to do is that we say, when you get the virus, what are the signs and symptoms? Just like you can have a common cold. When you have a common cold, what you do? You start sneezing, you're having runny nose sometimes, and you lie down. You know, most of the time people say, how to feel comfortable. When they're sick, they lie down on their back. When they lie down on their back, they feel comfortable. When you have a virus infection and you lie down on your back, you feel comfortable, but you're making it worse. Because when the virus get into your nose, it constricts your nose and you become congested. The fluid that the clear fluid that you could be draining down, it will not be drained down. That clear fluid will run to the back of your throat. It will run down straight into your voice bar, pass through your voice bar, it go down straight into your lungs. And that's that salty taste fluid is a good medium for bacteria. We have bacteria all over in our body. And those bacteria that we got all over in our body and inside our body, we call it normal flora. Those are normal flora over there. They are there to affect, to destroy anything that will go in our area. But when you irritate those bacteria, then they become poisonous to you. You see, those bacteria are part of your immune system as well. That's why they are there. But when you irritate your own immune system, it becomes poisonous to you. It's like to say you are raising this baby leopard or this baby lion. You are raising it, all right? But every now and then, you cut the meat and you put it down. And the baby lion is always want to eat that. And you know that is what they eat. And you keep playing with that. The baby lion is growing little by little. And you keep playing with that baby lion with meat. One day, that baby lion will eat that meat that you cut it. And the next thing, the baby lion will want to eat a dog, will want to eat anything that come around. That's how it will look like when you have the virus common cold and you lie down on your back. This salty fluid run to the back of your throat and get there. The virus is there. It's not going to get there, but what's going to get there is that what we call the complication of the virus. That's the pneumonia. So when this sweet taste water from your nose run to the back of your throat and it get down to the lungs, the normal flora over there will now use that sweet taste fluid as a medium to develop, to grow their poison. And when the poison grow, it get around your site. Now the lungs is like a balloon, like a small balloon. When you breathe in, the balloon inflates. Then when you breathe out, the balloon deflates. That's how it is. But when the normal flora has developed or grow their poison around this small balloon, we call the site. Sometimes we call it the alveoli. It has develop that poison around it, it will not be able to inflict. So when you breathe in, that balloon stay the same. You get it? That's the problem. That's where the problem lies. So let's say somebody who already has what we call COPD, chronic obstructive pulmonary disease. That means that person, most of their alveoli or lungs are already blocked or clustered, is not working. Then at the same time, you come and get the coronavirus to constrict your vessel to cause this sweetest fluid to run to the back of your throat. And the normal fluoride go in there and then develop a poison. It make it worse. So that's what we say pre-existing conditions are risky. So this is what you will feel. You attract this virus. You have, first thing, you're having runny nose. You're having, your body is really, you're feeling pain, body pain. At the same time, you're having headache. Sometimes you will have sore throat and other things like that. Sometimes you will not eat, and sometimes they will say to you, when you have the coronavirus, you will not smell. Normally, when you have a common cold, you will not smell because your nose is congested. Your sense of smell will be down for that time. So you will not smell anything. All right? So you will not smell. You have running nose, you have congestion, you have body pain, then you start running fever and all that. These are signs and symptoms you will have when you have the coronavirus. All right? So when you are in contact with anybody and you get to know that you are in contact with somebody, you put yourself down, all right, in a particular area that quarantine. This is the reason why sometimes ago in our country, the previous government, headed by Ellen Johnson Sirleaf, was told to build a quarantine hospital. Had she built that quarantine hospital in Liberia, it could have been useful today. Because anybody who come with, who you suspect that have been exposed will go right down in that quarantine hospital, because quarantine hospital is built in a way that it's built with all the ventilator, it's built with all the temperature, all the monitor, all patient monitor, okay, and oxygen, everything will be in the quarantine hospital. All right, oxygen concentrator, all of them will be there. The mask will be there. That's how quarantine hospital, when it's built, those are the things that we put in there. All those things are going to be there. So in case there's an outbreak here and we got a quarantine hospital, we will not have any problem. When we suspect that you have been exposed, we'll keep you over there for 14 days, and nurses will be there to monitor your temperature. Monitor your temperature for 14 days. In those 14 days, if they find out that your temperature is completely constant, no problem, then they will release you on the 15 days. You leave and go. That's why it could have been. So, if we had this in the tropical, in the tropic, like we got in Liberia, we could have this team headed by the doctor. We got nurses, we got administrators. They will go into those county, all the borough of Liberia, of Monrovia, let's say, all the borough of Monrovia. We go to Lockington, we go to New Cruton, we go to Douala, we go to Brewerville, we go to Sincor, we go to Oro, we go to ERWA, we go to Pinsville, we go to Red Light, and educate the people what the disease is, how it's transmitted from person to person, what can we do to stop the transmission. Okay? Those are the way we can handle a disease like this. In that case, the government will come and declare state of emergency. During the state of emergency, these are the steps that we are taking. Okay? We are taking a step. Those are how things are going to be. So for right now, let's take another break, and we will come right back and give you the conclusion of the day.
The virus that causes coronavirus disease is spreading in some of our communities. This disease, also known as COVID-19, is thought to spread mainly from person to person through respiratory droplets produced when an infected person coughs or sneezes. These droplets can spread to the mouth, nose, or hands of people who are nearby, or possibly be inhaled into the lungs. Take steps to lower your risk of getting sick. Here are some things you should do. Wash your hands often with soap and water for at least 20 seconds. You can also use hand sanitizer that contains at least 60% alcohol. Take extra measures to put distance between yourself and others. Avoid close contact with people who are sick. Stay home if you're sick, except to get medical care. If you have severe symptoms, please call 911. Cover coughs and sneezes with a tissue or the inside of your elbow. Only wear a face mask if you're sick and around other people, or if you need to take care of someone who is sick. Clean and disinfect frequently touched surfaces. Older adults and people who have severe chronic medical conditions like heart or lung disease or diabetes are at higher risk for more serious illness from COVID-19. This group should consult with their healthcare provider about additional steps to stay protected. For more information on COVID-19, please visit cdc.gov/COVID-19. Let's work together to protect ourselves, our families, and our communities.
So that's why we are. Good afternoon, ladies and gentlemen in the radio land. This is the Liberian Radio and Television Network. So that's why we were talking about when we have a team that will be educating the people, we will have that thing headed by the doctors and nurses and field workers and administrators. They will go into those boroughs and then first of all educate the people, and starting with what the virus is, how it is transmitted from person to person. When you get the virus, what is it that we're going to do? It has been approved. It has been a proven fact that somewhere the coronavirus respond to chloroquine. That is, that when you take chloroquine, the chloroquine will stop the replication of the virus, as well as zinc sulfate, 200 milligrams of zinc sulfate, as the same as 200 milligrams of chloroquine. So those two can stop the replication of the virus, which will not cause which will not cause any harm to you. So in Africa, we have chloroquine all around because we use chloroquine to treat malaria. All we could have done, or all our government could have done, is saying that's the case, we are going to ask India, because where chloroquine is being manufactured. So we will ask India to give us more chloroquine, bring it to the country. When anybody is suspected of the virus, we will put you, we quarantine you, and perhaps give you chloroquine. Or anybody suspected of having the virus, we will treat you with chloroquine for the meantime, until if you are taking the chloroquine, we know is going to stop the replication of the virus. That means you are not going to be it's not going to result into the complication of the virus, which is the pneumonia. You see, the complication of the disease is the pneumonia that gave people hard time to breathe. That is the last sign and symptom of coronavirus. When you start having shortness of breath, you cannot breathe, then it has resulted into the complication. You know, that means it has been over 7 days. It gone over 14 days. See? So it results into the complication. So that's why our country could have done, maybe in Liberia, this is what they could have done, and get more chloroquine, get more zinc sulfate, get more vitamin C, 500 milligram. That's it. Vitamin C, zinc sulfate, chloroquine, and Tylenol. Because you use the Tylenol to bring down the fever. Once you bring down the fever and the fever constantly down, it is not, the virus will not progress longer. And at the same time, they're taking their vitamin C. The vitamin C will help you. Is part of your your immune system. It will help your immune system. All right, that is one part. So you're taking your zinc sulfate, your vitamin C, your chloroquine, and at the same time you're taking your Tylenol to do what? To stop the fever. You know, this is what you could do. So with that regimen, when you get infected, that's what it will give you. That's what it will give you. But the important thing here is the education of the people. Let the people be educated. How can we, what the virus is, when you are infected with the virus, what you should do, how can you treat it? Okay, this is the way. So, and how the virus is transmitted. So, prevention is better than cure. So, let us prevent the spread so that we will not be confronted with curing the virus, curing the people. All right. So, to prevent the spread is to wear the mask and stand 6 feet away from the person. All right. Then from there, if you go to any office, you hold a doorknob. You go anywhere, you hold a doorknob or anything like that. When you come back, first of all, wash your hands. Wash your hands for 20 seconds at least with soap and all under your ring. Wash it and wash all behind your hand and everything like that for 20 seconds. Rinse your hand and then dry your hand with a dry, clean paper towel or a towel. You see, that's one way. Those are the ways those are the method we will follow in order to prevent the spread. All right, you got the mask on. You steady 6 feet away from you. Then when you go and you touch something, you wash your hand before you eat. But before then, that's what we're doing. When you cough in the napkin or you cough in the handkerchief or something like that. Okay. Then you wash your hands before you eat. But now that the coronavirus has come, they have added the mask and this distancing. That means you have to distance yourself, you have to wear the mask. Certain place now in America, when you don't have the mask, you will not actually go in there. You see? So you have to get used to wearing a mask. You have to get used to standing at 6 feet away from the person. Once you are in the public. Now back home, we understand when the people, the lockdown, say 3 o'clock you should be off the street. All right, 3 o'clock they are off the street. When they are off the street and go into their various houses, they can be there. If they don't want to wear the mask, okay, fine, they are at home. But once you don't do that now, once they are doing that, there are no need to bother them. When they are home, they don't wear the masks, no problem with that. So let them stay over there. But when they come out into the public, they got to be educated that they have to stand 6 feet. They have to wear the mask. When they touch something, when they go home before they eat, they have to first of all, wash your hand, clean, and where they're going to put the food, clean the spot and other things like that. You wipe the surfaces and other things. Okay, those are the things that you can do. But distancing and wearing the mask are the two important things that we can do. All right. So this has been the platform for education, and our topic was on the coronavirus and how we can prevent the spread of the virus. So we want you to know that, and at least some people who are in Liberia will hear exactly what we're doing and how we can do it. And just for you to know what are we doing, how Liberian can be motivated, how can be encouraged, promoted. We will promote and congratulate Jason. Jason, a Liberian ambitious and gifted little girl who had a longer story, took part in the American Idol and was victorious last night. So we can say congratulations to Jason. So we know there are many Liberian boys and girls out there who are gifted just like Jason. So we should always promote one another. This is what we call Liberianization. Promote one another, encourage one another, so that we can be competitive to events in the world. So if he gave a Liberian man a chance, he would move the world. He would, be proud. We will all be proud, every one of us. Okay, so thank you to every one of you. And next will be today, Monday. Next will be on Wednesday. Next platform for education may be on Wednesday. All right, and we'll be talking on different topics, but closely to the coronavirus. Thank you. Bye.